Hello, I'm Pam Martin, and I'm here to talk to you about type 2 diabetes and how to manage your diabetes. When you have diabetes, it takes work to stay healthy, and one of the most important things you can do is to check your blood glucose regularly, because there are many things that can cause it to go up or down. It's important for you to know how these things affect your glucose. You already know that your blood glucose changes based on what you eat. And you probably know that what you eat, especially carbs or carbohydrates, can affect your blood glucose. Some other things that can raise your blood glucose are stress, illness, medicines you may take, changes in your hormone levels, not getting enough physical activity or exercise, and not drinking enough water. Some things that can lower your blood glucose are drinking alcohol, taking more insulin or other diabetes medicine than you need, and too much exercise. Now that you know about all the things that can raise or lower your blood glucose, you can see why checking it regularly is so important. Common times to check your glucose are right before you eat a meal and 1 or 2 hours after a meal, but your doctor can tell you when it's best for you. You should also check your glucose anytime you don't feel well. If you feel shaky, dizzy, confused, nauseous, weak, tingly, have blurred vision, or have headaches, you may have low blood glucose. A glucometer is what you'll use to check your blood glucose level. You may hear people call this a blood glucose meter or just a meter. Ask your doctor how you can get a glucometer. If you need a refill on supplies, call your pharmacy or doctor. Now let's talk about how to test your blood glucose. First, gather the glucometer, test strips, lancets, and your lancing device. This is usually the pen-type device that holds your lancet. Also, don't forget your pen and blood glucose log. Next, wash your hands with soap and warm water for at least 20 seconds. Then, put your lancet in the lancing device. Insert a test strip into your glucometer. Place the lancing device against the side of your finger and press the button to release the lancet so it pricks your finger and lets a drop of blood form. Touch the edge of the test strip to the drop of blood and wait. Make sure the drop of blood is large enough for the testing strip to read it. In a few seconds, you can see the result on the screen of your glucometer. Try not to share your glucometer with anyone else because it will be hard to determine which blood glucose numbers are yours. Write down your number along with the date and time in your blood glucose log. For many patients, a blood glucose that is too low would be anything under 70, but your doctor will tell you what a normal glucose range should be for you. If your blood glucose level is too low, eat 1 serving of a quick-acting carbohydrate food or drink that contains about 15 grams of carbohydrate or carbs. Examples are juice, regular soda, and regular hard candies. If you have glucose tablets, read the label to see how many you should take. Avoid these foods and drinks unless you have a low blood glucose. Retest your blood glucose after 15 minutes. If it is still less than 70, or the cutoff that your doctor recommends, have another quick-acting carbohydrate. Wait another 15 minutes and test again. Every patient is different, so it's important that you see your doctor regularly so they can help you figure out what is best for you. The more your doctor knows about your blood glucose levels, the more they can help you. So bring a log of your blood glucose readings and a list of medicines you take to each visit. This will help them figure out if you need to make any changes to your diet, exercise, or medicines. Don't be afraid to ask questions during your doctor's visit. And before you leave, make sure you know these things. When your doctor wants you to check your blood glucose, what a healthy blood glucose range should be for you, what your plan for your medicines is, what you will take, when you will take it, and how you'll get refills when you need them, what to do if you have problems between visits, when you should come back for the next visit, and who will make the appointment. Your healthcare team can look at your lab results and glucose results and help you come up with the best plan to stay healthy. Food, exercise, stress, illness, and medicines are just a few of the things that can raise or lower blood glucose. When blood glucose gets too high or too low, you likely won't feel well and are at higher risk for bigger health problems. When you monitor your blood glucose levels, you can learn to make decisions that keep your numbers in a healthy range. When you share this information with your doctor, you can work together to make your health the best it can be.